Good afternoon and welcome to the CHUH webinar, Increasing Cost Avoidance for Medicaid COB. My name is Rebecca Beatty. I am a Senior Marketing Manager at CHUH and I will be the moderator for today's webinar. Before we get started, I'd like to review some housekeeping details. Today's session is being recorded and by the end of the day tomorrow, you will receive a link via email to the on-demand webinar that you may share with others. The recorded webinar will also be posted tomorrow on our website. Your phones will be muted throughout the webinar today. All questions should be submitted online. You may ask your question at any time throughout the session. Simply type your question into the right side of the GoToWebinar panel. We will address your questions at the end of today's presentation. Now I'd like to introduce today's presenters. They are Laura Carraway, Director of Operations at Anthem's Government Business Division, and Kelly McNair, Business Development Manager at CHUH. I will now turn the presentation over to Kelly.
All right. Thank you, Rebecca. And thank you all for joining today to learn about cost avoidance for Medicaid COB by leveraging CHUH's Coordination of Benefits solution, COB Smart. We have a lot of folks from across the country on this webinar, and I recognize some of you as current COB Smart users, and some of you may not be as familiar with the solution. So first, I'm going to level set on the industry's challenges with coordination of benefits and how CHUH's COB Smart addresses those challenges. And then Laura from Anthem will talk about her experience managing coordination of benefits for Anthem's Government Business Division, why they decided to use COB Smart, their process for leveraging the solution, and the value in using the solution for their Medicaid business. She will talk about some lessons learned from their experience, and we will have plenty of time for questions. So as Rebecca mentioned, please submit your questions through the GoToWebinar panel. For those of you who are not familiar with CHUH, we are a nonprofit alliance of health plans and industry trade associations who come together to create solutions that streamline administrative processes in healthcare. Our solutions are unique in that they are created by health plans for health plans, and they take an industry-wide approach to deliver value to providers, patients, and health plans. So about 6 years ago, our board member health plans and trade associations, who are listed on this slide, identified coordination of benefits as a significant administrative burden for health plans. So at that time, health plans' approach to managing COB was overwhelmingly reactive because they were discovering COB existed after claims had already been submitted. So they were forced into this reactive approach really because they didn't have a good picture of their members' other coverage. Their processes for capturing COB data were largely manual, so it was oftentimes missing or inaccurate. And without having access to good COB data for members, claims were inevitably paid incorrectly, which resulted in administrative inefficiencies trying to correct the error. So with this reactive approach, plans, providers, and patients are all negatively impacted. So plans use a lot of resources deploying member surveys to get information on their members' other coverage without success. They're overpaying or paying claims incorrectly. And then they're dealing with expensive vendors and other resources to correct the claims, and it's a significantly burdensome process. For providers, claims are not paid correctly or on time, and for patients, they're confused and frustrated when they receive these COB surveys, and they just want their claims paid correctly. And CHUH estimates that the industry spends about $800 million annually just on administrative inefficiencies related to COB. So specifically as it relates to Medicaid plans, there are additional challenges related to COB. So there are state requirements to utilize state-generated data, which creates quality and consistency challenges. And then there's simply the nature of Medicaid business, and that Medicaid beneficiaries often have multiple breaks in coverage over the course of a year, which causes data to become outdated quickly. But there are also unique opportunities for Medicaid plans with COB. So we're seeing about 13% of Medicaid beneficiaries having other coverage, and as the payer of last resort, Medicaid plans have the greatest opportunity to save money through accurate COB. So how do we get there? CHUH recognizes that health plans must have accurate other coverage information on their members in order to have a more proactive approach to COB and pay claims correctly the first time. So we launched our COB Smart solution to give plans exactly that. So with COB Smart, participating health plans submit a thin layer of member data on a weekly basis, And then COB Smart identifies individuals with overlapping coverage across participating plans. Our built-in primacy engine determines the order of benefits. And then we share complete COB data with health plans. COB Smart participating health plans are recognizing the value of the solution in a number of different ways, and mainly through minimizing overpayments and incorrect payments, decreasing COB costs per member, using their vendors more effectively and efficiently, making better use of staff time, and ultimately delivering an improved member experience. Our solution really takes a completely different approach to COB, and one that is free from conflict of interest and focused on prevention. And what I mean by that is that we are giving COB data to health plans on a prospective basis for the exclusive benefit of the health plan and not to charge recovery fees. And to that point, there's no incentive for inefficiency. So we charge a flat per member per year fee for COB Smart. We're also the only national coverage database that is supplied and maintained directly from health plan reported data on a weekly basis. So currently we have 35 health plans participating in COB Smart, and this number continues to grow. So clearly we've outgrown the slide for listing all of our participating plans, but you'll notice that we have all of the national payers participating, as well as many regional plans. And all of these participating plans represent about 2/3 of the covered lives in the country. So with that, I'm going to turn it over to Laura to talk about their experience with COB.
Great. Thank you, Kelly. Good afternoon, everyone. So just a little about Anthem, in case you all haven't heard of us. I know I say that tongue-in-cheek, but for us, we insure over 40 million lives, and my group, we represent about 6.3 million of that in the Medicaid space. And, our vision is to be the most innovative and valuable and inclusive partner between us and our members. So that's just a little bit about us before we jump in. Really for us, prior to taking on the implementation of CAQH, we really did rely a lot on numerous vendors and state files for validated data, lots of different intake sources. And because of that challenge around intaking different sources at different time levels and things like that, we had some challenges. So we would get incomplete data that didn't give us the full spectrum of the data elements we needed to coordinate our member correctly. The data that we work with the vendors can be costly for us, whether it is on the prospective or the recovery side of it. And then there are times that the information that we get is outdated. I'm sure those of you that are working with your Medicaid plans, as there's been a more focus on TPL and COB over the years, some of that's changed, but at times we may not get things until a monthly file or maybe twice a month. And that cadence of it in the Medicaid space sometimes can leave us in a place where we've already missed our opportunity to do a prevention and now it's a recovery. And then quality was always an issue with our vendors in that space. Sometimes quality, just the timing of it. And then with our state partners, there was variability in the quality of the information that we were getting in across the board. So for us, those were some of the challenges that we had in our program in our space. Really for us early on, and we started participating about 5 years ago in the process. And we really went through some understanding of how to select from the criteria, right? One of the value propositions is that CAQH provides weekly updates to track the members coming in. So especially in our Medicaid space where members may come in and out of coverage, it was really important for us to have the most timely information that made sense for us. And then the cost savings per member per year compared to some of our other processes and vendors was a significant value for us. And then the quality of data to really deliver a better experience was important. I'm sure you all experience the partnership that you have not only with your members but your providers. When we get things wrong or we don't do things timely, it can really impact that relationship that we have. And really the value proposition is we want to reduce the administrative burden on our members and our providers because we get things done right the first time. And then the other big piece of it is, as you can see from the slides that Kelly showed earlier about the expansion and the different plans that are participating, there's a lot of robust participation that helps us get the coverage that we need by utilizing the COB Smart. So those were some of the elements that when we were looking at evaluating the program, we took into consideration. So for this one, let me orient you just a little bit to what you're looking at, because I know it's a lot of information on one slide, and I'll talk to the top part here in a minute. But really, as I mentioned, this bottom workflow is what we talked about before prior to CAQH. We had data coming in from lots of different places, from regional staff, from different areas and intakes. And everything coming in from those intakes needed 100% of a quality data review. And then for us, for the most part, that required a phone call and then a manual update into our system. So there were a lot of manual steps at a large portion of our intakes and information. So in the process that we have today and the integration with the COB Smart, which is that top line, what changed for our program is we received the COB Smart data from the group, and it actually comes into what I'll call a landing space. So our business analysts intake the information, and they really actually take 2 steps, and that comes into our triage place of it. So a portion of our data currently, about 25% of it, we actually have automated that once the business analyst does some triaging and intaking and we apply some business rules, it doesn't need any quality updates or verifications, and it goes automatically into the system. And then the other piece of it that we're looking to actually move more and more into the automation, we do have a process where we intake the information manually. And we integrate it into a workflow tool so that it becomes integrated with other intakes that we have. So we're really working the member in a holistic way. And then if we have questions about the data, we can use the COB Smart portal, or we can even contact the plans through that portal if there are questions about the information that we're getting that don't look quite right for us. And then there still is that manual piece of it. So I won't, deny the fact we still have manual touch points to our information, but the amount of information that we're getting in a timely fashion has increased. And then we're working on the best way to automate and manual to ensure that we're still providing that great service to our members and our providers. So one of the other big pieces of us and really the benefit of using it, and I'll talk about this box on the left first, is you have to have reporting to make sure that as you're adding something to your program, you understand the impact and the measurement of it. And so we started in the implementation of it, some monthly reports that really track the data broken down by markets, because I'm sure others on the call experience, you have different rules for different markets and you have different reports that need to happen. So for us, it was critical to make sure we were able to report by each individual Medicaid market. And then in addition to that, we determined what value we get from our state files versus our COB Smart files versus our manual processing. So we actually have a way that we can look at our program, because the way we tagged things in our system to say, okay, it came from this source or that source, so we can truly show the value of each program segment as it is added. And so for us, we are seeing over the last couple of years, and especially this last year in our most recent reporting, about a 3 to 5% increase in our cost avoidance. And that's month over month. So some months it's 3, some months it's 5, but that is really where we see the range of impact in the information that is automated through our data application. And we know there's even more cost savings in addition to that I'll talk about in a couple of slides later about what we're looking to measure even further. But that's where we also are seeing some reduction in some of the vendor fees that we're having to pay, because we're catching it earlier. We're looking at prevention. We're further along in the process so that we're not having to pay out all the information. And then the other big benefit for us and our group, both on the Medicaid side and the commercial side, We just came back from a conference with CAQH a couple of weeks ago, and it's the continuous improvement that we share through best practices that's another big value add. So we actually learned from another health plan, and other health plans learned from us some things that we could do to improve our program from an automation standpoint that we'll be able to evaluate how we integrate that into our program. So it's really an opportunity to kind of share and partner across the board with other carriers who are really in the same boat as us. So when we look back and reflect, there's a couple of really lessons learned for us. One that's not on the slide, but I'll talk to, is in our space, both our commercial partners and our government business. So my group and then another peer group, we all participate in CAQH because we were able to see the value of having that benefit on both the commercial side and the Medicaid side. And the business cases look a little different, but that was one of the great things, is we could continue to learn with each other in a fully integrated program. So automation is definitely beneficial, but what we found at the onset, and this was early in the process with CAQH, is our recommendation is don't fully automate immediately. Make sure that you understand the information and how it's coming in and how you want to apply it at a pretty robust rate. So working with the data at the onset to make sure you've got the right business rules for automation and manual is what worked for us. And the other piece that we found was a little different than some of our other elements is we treated COB Smart as really as a program and not just another data source. So for us, it was how did it integrate into what we were doing as a program? And it has the word separate on here, more for the impact of saying it's not just another file. You really need to be looking at what are the elements that need to be set up. So there's IT pieces of it. There's people understanding how to analyze the data. There's reporting that has to happen. So for us, it was making sure that we really understood, yes, there's some investment to make it a program approach, but the value of it is returned. And then the other piece is putting in processes that determine how to best leverage the quality of the carriers coming in. So as a large organization, there's different systems that we have different products in and things like that. And we learned that other carriers have the same experience, right? You have different systems and different intake sources and things like that. And the quality of the information, you don't always get that feedback directly from users. So as we started participating in CAQH, we could provide a feedback loop back to CAQH to say, hey, this carrier, we're getting information and something's not right. So maybe a group changed and the system didn't catch up or things like that. So for us, it was evaluating carrier by carrier who has the high quality that we can go ahead and automate, and then who has the information that we may need to have a little more hand-holding with as they're working on really improving their quality. And CAQH has been putting elements in place to even improve that along the way as well. And then the implementations that happen really require some IT investment. You want to make sure that your data going out is of high quality, because to your point, if your data is high quality, then the people you're passing it off to can automate it. But it's also important that as you're intaking the data, you understand how to apply that information to your system, because each one of us may have some unique ways that we need to build our logic. So for us, we have essentially three main goals that we're looking at for the expansion and enhancement of our program. Really the better utilization of the analytics to help create some synergy with our IT team for better monitoring. So is the information that we're sending out good information? When somebody terms in a product, are we making sure we're sending that to CAQH so they understand? And do we have a good understanding of how much comes in and processing? Because it is going to be a large amount of data at the onset. And then we're looking to expand our scope into our Medicare business. That is something, because of the nuances with the MSP files and the COBC files, we haven't fully integrated into our program, but we now have some analytics that are going to help us do that. And then really having some more detailed report tracking from the recovery side. I mentioned our benefit has been on cost avoidance, and that's what we've measured on the Medicaid side, but we really wanted to look at the program more holistically. So for us, that meant adjusting some reporting to make sure that we knew how to really evaluate the full program. So I think for me, that's really our kind of our story and our lessons learned. So I'm going to turn it back over to Rebecca and Kelly for our next piece.
Great, thank you, Laura. So now is the time during the webinar where we will answer your questions. So again, please remember to submit your questions by entering them into the questions section of the panel on the right-hand side of your screen. And we do have some questions that have come in already. So the first one is for Laura. Do you track how much of Anthem's primacy rate has increased or how it has changed due to participation in COB Smart, as other plans can now funnel their claims to Anthem, which they may have been paying as primary before?
That's a great question. So at the detailed level, I would love to say that I've got reporting that looks the primacy. I know on our commercial side that is something they have a little more robust in. For us, because it's Medicaid is the payer of last resort, we take it in a little more holistic approach of the cost avoidance piece. So we have seen an increase. What I wouldn't be able to measure is the exact counts and the impact, but we have seen that increase in our avoidance, which to us is the trend in we've determined more primacy prior to the submission of the claim.
So we have we have several more questions. This one is also for you. Can COB Smart be used within the recovery side as well, i.e. for pay and chase as opposed to cost avoidance only?
So I don't know enough about the person's program to definitively answer that, but for us, the answer is yes. So we are able to, when we intake the information, we apply it whether a member has a claim or not, and then we have a tight partnership with our recovery program who then utilizes the information, and as part of that pay and chase is part of their program. So yes, there are ways, and it probably depends on your system configuration, but if the system is configured to set up pay and chase, but you are still able to load that into the system, then it's a great partnership with your recovery team. But for us, it definitely is a whole program. We look at prevention and recovery because we all very well know that we're not going to catch 100% of everything, right? I always like to make a joke with my recovery partner. I'd love to put you guys out of business, but there's so many nuances and changes to our Medicaid members that doesn't always happen. So I would say that, yes, that is a possibility for the partnership when it comes to pay and chase and recovery.
Great, thank you. We had another question about the stat that we shared earlier in the presentation with 13% of Medicaid members having some form of OHI. So Kelly, do you want to comment on that statistic and where it came from?
Yeah, so CAQH does industry research and collects data points like this. And so this is based on CAQH findings. So Laura, I don't know if you wanted to comment on your experience with the other health insurance that you're seeing within your Medicaid membership.
Absolutely. So for us, we have variability, and I'm sure our other Medicaid member groups experience this. So it really depends on the saturation and the mix of within the market that you're in. So we do experience some of the percentages that CAQH is talking about, but we do have markets where the experience is lower based on the mix of members that we have and the opportunity that a lot of them just don't have the coverage like we experience in other markets. So we do see a variability in the percentage of members. I think 13 is really on our high end, and then we have a little bit lower than that in other markets based on the mix.
Okay, thank you. There is a question about if the slides are available to be emailed. Yes, everybody will be receiving a copy of the presentation tomorrow, and we will, especially for the person who asked, I'll make sure to get you a copy of the slides. Another question, taking COB Smart as a standalone application as recommended rather than as another source, what interoperability does COB Smart have with the QNXT platform for creating or modifying external enrollments?
So I'm not, for the person who asked this question, I'm not familiar with the QNXT platform, but in terms of standalone application, what we're seeing is some of our health plans, they have developed processes that incorporate COB Smart as a source that they're using as they are building out their COB processes. But a lot of times they will use COB Smart in addition to some other vendors, kind of as Laura was talking about earlier too. There's really so much to, in terms of the end-to-end COB process, that COB Smart plays an integral role in providing plans with the data they need to then go and make any necessary recoveries, leveraging other vendors.
Great. Is this just available for medical coverage?
Yeah, so currently COB Smart does only address medical COB. We are in the process of figuring out an offering for dental COB and other types of benefit overlaps as well. With that said, we are capturing all different benefit information from plans, but we're only providing you with COB data related to medical COB.
Laura, someone had asked, since you had shared that you were able to load 25% of the file without any validation, and that the rest kind of needs to go through confirmation, how many FTEs do you have dedicated to reviewing the 75% of the file?
Yeah, that's a great question. So I will be transparent, and I don't have anybody completely dedicated to CAQH as an only intake source, but I do have a team of about 15 people that focus on really increasing our program, which includes the majority of their work as CAQH. So right now we're in the process of evaluating then what does that look like? Is it right sized for this team and really the focus on it? Because this was something that we put into place about a year ago. So we are still evaluating the sizing of it. But as of right now, it's about 15 people that a majority of their work is CAQH, but then we have some other supplemental work that they support that's important to our program.
Great, thank you. Another question about the 75% of that data. How do you actually validate the data? Do you just leverage the portal, or are you also making phone calls and using other means to validate that data?
Yeah, that's a great question. So I will say at the onset of it, we were using more tools outside of the portal. So we have some different online capabilities to check some different sources. We also were making some phone calls. I would say that the majority of our work that we're looking at, we are using the portal, but if there's something that we are just not seeing where we want to, to have a little more information, we may call the carrier directly or check another source. And that is part of how we've been able to give some feedback loop back to CAQH to say, hey, we saw something in our data or in the portal that didn't quite look right. So they've been able to pass that back to the carrier. And then we now have some additional functions inside the portal that help us with that conversation anyway. So more and more we're integrating and utilizing the portal really as the biggest piece of our source for verification.
For the 25% that you are automating, how did you come to the comfort level that you feel comfortable auto-loading? What did you do to reach that point?
Yeah, that's a great question. We learned some things at the beginning, right? Because we turned on, unfortunately, we learned some hard lessons at the beginning of which ones got the noisiest because we got some member and provider complaints. So I would suggest that maybe that's not your approach, but there is a set essentially of data matching that we're looking at. So we're looking at key elements like effective and term dates, policy numbers. And so if that information is regularly seen, then we look at applying that through automation. So part of what we did at the beginning was we had to turn off some of the noise, the ones that we were automatically getting complaints about. We said, okay, we're going to pause that and then we'll take a look at it. And so now we're trying to pick that back up, which is why I mentioned the moving to more automation is now we've defined a set of criteria to say if it matches maybe these 5 or 6 elements through our manual review process, then we can move to automation. So I will tell you our comfort level has gotten more comfortable as we've understood the data and working with it. So we're hoping that other plans, and that was one of the things we did learn through our CAQH partners and one of the other carriers that put some things in place that are helping us get more and more comfortable with our automation.
Okay, thank you. Can you talk about the biggest difference that you see between COB Smart and some of the other vendors that you work with?
Sure. So for us, the big difference, and I kind of mentioned it with the partnership and the council and the things that we're learning, it really becomes a partnership, and it's less transactional. So it's not I'm going to give you this, you give me this. It's hey, how can we help you? How can we make you connected with the other plans and membership people so that you better understand not only what they're doing in best practice, but they also help you understand what's working and not working with your data so you can improve that as well. So for us, I think if I had to quantify it, it's that partnership versus the transactional nature that sometimes we experience with our vendors, even the ones that we do have great partnerships with.
Okay, thanks, Laura. Can you and Kelly maybe both just give a little bit more detail on what the portal is and how it works and, how that is part of your workflow?
Yeah, so I'll start with giving a just high-level overview of the portal. So plans are getting this COB data through a file exchange, but they also have access to this data through a portal where they can look up members on a one-off basis and look at other coverage information in that way. So I think that the question was perhaps leveraging the portal versus leveraging the data from the file.
And to tack on to that, I think the other piece of it is you can go in and search for a member and things like that, but the other benefit that we use the portal for is, one, there's a contact list, so if you have an issue, you can reach out to another carrier. But the other piece of it is any documents that are shared by CAQH are stored in the portal. So if it's a file layout or it's a training document or something like that, you have access to those things. So that way you're not always depending on, oh, hey, I've got a new group coming in, I want to train them on the portal. You don't have to go back to your CAQH account manager every time. You've got some resources that are at your fingertips right there too. So those are some of the ways that we're using it, not just for the verification, but for some of the additional benefit too.
Okay, thank you. Can you speak a little bit more about, you mentioned there's an IT investment that's required. Can you talk a little bit more about what that is?
Sure. And I'm going to speak about it at a high level. I am not IT. I will say IT friendly and have great partners across the board, but it's essentially twofold. And depending on how your IT team is structured and funded and things like that, there is an investment that has to be made on the extract that goes to CAQH to make sure that you're sending your active members that you really want the information back on. And you may experience that some of your IT partners don't know the enrollment and COB data at the level that maybe the business partners do. So having that connection between IT and business at the onset. So you want to make sure your data and information is quality going out. And one of the things we learned with CAQH at the conference is some of the groups do it directly from their source system. Some of it do them from a database or maybe an extract of their system. So making sure whichever one you choose, you really understand the information going out. And then there's going to need to be a group that intakes that data. So there's some IT partnership on that element of it. And you'll get reports like a missing records or things like that they will help you intake. And then we also have on the business side some business analysts that become that link between business and IT. So it's a couple of fold depending on your structure, but there is an investment for an outbound and the receipt of an inbound and applying that. If you're going to use automation, you definitely want your IT partners as part of that as well.
So there was a question about, if you're validating information in the portal, why is that information not coming into that initial file? So can you just speak a little bit about that?
Sure. So some of it is because we may be working a week behind, depending on how much data we intook. So we want the most up-to-date information. And then there are times now that maybe something went out from a carrier and they realized they needed to make a correction, and there may be some corrections already showing in the portal prior to the next file being received. So those are some of the reasons why we may see some differences with the information. And really, to be honest, too, if you're thinking about your frontline staff, if maybe they only got a portion of the information, you don't want them to have to go back and look at a big file. It may actually be easier for them to pull it up in the portal and see what was reported. So there may not always be a difference, but sometimes it's an ease of accessibility for your frontline staff to get to a data set that you need them to get to.
There was a question about the privacy of the enrollment data. How do we keep that secure?
Yeah, so the data that's being exchanged is done so through a secure file transfer protocol, and the solution is HITRUST certified. So I'm not an IT security expert, but in the IT security world, that is a huge seal of approval. So all of our CAQH solutions have that HITRUST certification.
Just to let other health plans know, is we also had to be required to make sure certain information is encrypted or truncated to protect the members. And then there's even some different authentications when you're working in the portal that have to occur too.
Of the 13% of your COB rate, are you able to track how much of that is coming through COB Smart?
So ours is, just a reminder, it's not always 13%, but yes. So we have an ability to break down in cost avoidance and recovery by market, the ones that are done through automation, and then we are reworking how we're tracking our manual information so that we can segment out something that came just from the CAQH file. So it's a little bit of a yes and no. Yes, from an automation perspective, and no currently, at least as the level of detail I would like, but that is our next level of enhancement of reporting that we're getting ready to shift on.
Okay, great. Another question, how long did it take you to build the file format that was needed for the weekly file exchange?
That is a great question, and I will have to say, since we started the building of this before I took my role on, I'm not sure how long it took. One of the things I do know that CAQH has a standard format. Some fields are required, some fields are optional based on your piece of it. So it's very similar to any additional extracts that we've created in other spaces. So for us, it depends on the IT lift, whether it's a contractor or a full-time FTE, but it's pretty standard as far as creating an extract. Even when we made an enhancement to it, I didn't see a big difference in the creation of that extract versus some others that we do for our state partners.
Yeah, and I'll just add that on average, it varies by plan, but on average, we're seeing it take about 200 IT hours, and that's really driven by the availability of dedicated IT resources that the plans have to help with this file.
Another question, as a Medicaid plan, what do you think is why should Medicaid plans participate in COB Smart, and what are the major benefits that they will see from this?
I think part of this is a repeat, just to reiterate. For us, the why was really trying to, at a greater rate, have more of that proactive approach, right? We'd rather service our state partners, our members, and our provider right the first time, so that the timeliness and the accuracy continually works to increase. And that for us was the big why, to really move from that and the cost savings associated to it. So our experience, we have seen some cost savings by adding CAQH. Even before we started changing some of our other programs, we saw an initial value, and then we're continuing to see more value as we leverage it at a higher rate. So for us, that was the big why do it.
Okay, thank you. One last question. Any advice for a plan considering the solution?
Oh, that's a great question. Any advice? So I think some of that I talked about in our lessons learned, right? It's know the information coming in, understand what's going to work best for your program, So whether that's automation or manual, I think that would be our recommendation. You want to have a thoughtful approach, which I'm sure all of you do. Anytime you're implementing something new, you want to be thoughtful. Understand that it is going to take investment. So it is telling the story, helping your leaders understand what that looks like. And I know that is definitely hard as you are experiencing something new, but that would be our recommendation. Find a way to tell your story, and then make sure you have a plan that includes IT and resources and knowledge-based people who know and understand your data, not just from the front line, but from the back end, to make sure that you utilize it in the best way possible.
Yeah, and I'll also add that for any health plan that's considering or evaluating the solution is as valuable as the plans who are participating. So the more plans that are participating in this solution, the more valuable it becomes for everyone and gives you a more complete picture of your members' COB or other coverage.
Are you seeing, Laura, any kind of changes or trends with Medicaid beneficiary dual coverage? For example, more recurring gaps in coverage, more frequent status changes, more dual coverage with commercial plans, et cetera. Have you seen any of that change over time?
That is a great question. I think for us, it's been variable based on some of the different market trends. There are times that I've seen less and less markets where members have the coverage. I don't know if it's an affordability or what the trend is. And then for us, I think we've always seen some volatility in our members. You know, members go in and out of their workplaces, and they have different life events that occur, and we're working with children and people who are different in and out of different situations. So for us, I think we've always seen kind of that swirl of the back and forth, and then we also have members who stay in products for quite some time and are more stable. So I don't really know if I've seen any big changes or trends that are really widespread, but we do at times experience in certain markets where less members have the coverage, or they have some patches of coverage that have large gaps in them.
Well, I think that's all the questions that we have for today, unless anybody has any last questions they want to type in quickly. So I want to thank everybody for joining, and also have a big thank you to Laura for presenting today. As a reminder, tomorrow you will receive an email with a link to the recorded webinar that you may share with your colleagues. And for any more information about COB Smart, you can always visit the CAQH website, which is cobsmart.org, or you can email our team at sales@caqh.org. Thank you so much, everybody, and I hope you have a great day.